welcome to Plastic Surgery Talking Advice. I am your host, Earl Stephenson Jr., board certified plastic surgeon here in Atlanta, Georgia for the last 20 years. I was sitting around thinking and noticing a trend. It's a slow trend. I don't know if it's really out there front and center, but I think people are reversing and doing less. And if they've already done more, they're trying to get back to a more natural state. So I thought to myself, are people looking to reverse plastic surgery that they've already had done? And I think the answer is yes, again, but it's not as simple as you would think. It's not that can you reverse it? Yes. Can you reverse it? No. It's maybe. And that's kind of the worst place you can be because you don't really know. So sometimes if you're considering this and you've not had this, then you want to stay tuned and listen. If you've had this, then you want to stay tuned and listen because you can pick up how you might get back to a more natural state because you want to be able to save your time, your money, and a whole heck of a lot of stress. So, on that note, I've got a bit of business as usual. If you're new to the channel or returning to the channel, thank you for joining me today. Please do a couple of things. I want you to like this video. I want you to share this video, and I would love for you to subscribe to my podcast and to this YouTube page. It really will help me continue to build momentum. So, on that note, we're going to talk about three procedures that I think are undergoing a little bit of a slowdown and how many are being done. And if someone's already had these done and really had them done in a very overstated way, how these clients are looking to kind of, again, dial that result back. The first one is lip fillers. And I'll be very specific. It could be any type of dermal filler, whether it's cheek or lip, but typically lips, because, people are really critical of overfilled or unnatural faces. So I'm going to talk about reversing lip fillers. The second procedure, I'm going to talk about taking out breast implants. There was a time when bigger was better. And now I think that time may have passed. So we'll talk about removing breast implants. And then lastly, again, there was a time where you want to have this big old booty, and that was kind of pushed forth by culture, celebrity. And now I think that time is kind of passing as well. People want a more natural, I would even say an athletic look. So we'll talk about, reversing BBL or Brazilian butt lift surgery. So on that note, let's start with fillers. So fillers are man-made substances replacing a natural substance in your body. The natural substance is hyaluronidase. And that's the substance that gives, and I'll use my own skin, your skin volume, suppleness or softness, and mobility. You want to have, nice suppleness in your cheeks. You don't want to look too gaunt. You want to have, full lips for your proportions of your face. Don't want to have a lot of lines. Unfortunately, I do. A lot of lines. So these products are used to soften those areas. And they're really meant to be really done so that they are very understated and natural. We've seen extremes of those, again, pushed forward by celebrity and culture. And so there was a time for that where you see women with these huge lips, they look like ducks. Or you see these huge fills and they look like a pillow face. So I think those days are behind us. Even the celebrities that pushed this forward where they were overfilling things are taking those steps back and again pushing culture to say, you know what, more natural is better. It gives me better facial balance because that's where I want to be and that's where it's at now. So having fillers placed, and these fillers are, under proprietary names. It could be Restylane, it could be Juvederm, typically, and they're hyaluronic acid fillers. And these fillers are typically placed, as I mentioned before, in your lips, your cheeks, your tear troughs, sometimes your jaws and chin. And you can have those done very well, but over the top. Or you can have those done and you can have a disaster. In either case, you want something done if you're unhappy. And the question is, can something be done? And for this particular procedure, it's yes, it can be done. You can use a product called hyaluronidase. And I'll bring up a picture of what I use here in the office. And we don't use this often. Thank goodness our clients are really happy with what I do for them as far as their tweaks. But we have it here in the office. And we typically would use it if a client came in, whether it was someone I did, which is rare, or someone else from someone else, if they had overfilled lips, cheeks, and jawlines. We kind of talked about that. If they've had a filler placed like in their lips and it's migrated, meaning it's moved to another area, then we would put it there because the filler's in an unnatural area. Now, I've not really seen a lot of migration. I've heard about this over years, but I don't see that in my clients. Where I put it is where it stays. So I'm not really familiar with seeing migration and that, what can I say, that phenomenon, but it's out there. And so people are saying my filler has moved. Be that as it may, is in a place that they don't like, whether it was placed there in the beginning and they're just noticing it, or it truly did move. It's neither here nor there. They don't like it, and that area can be treated with a dissolving agent. Sometimes you treat people and you think you've got it balanced, and after the swelling goes down, you see that they're not balanced. And so, where you have some asymmetries to the face, then you can do one or two things. You can add more to the side that lacks, if that's what they want to do, or you think you've already at maximum and you don't want to really fill it anymore, then you can dissolve both sides. And so you can use dissolving agents for that. Obviously, if you've got lumps, bumps, nodules from a bad reaction, you certainly want to dissolve filler if it's still around or if it's threatening the area that it's placed. So those are indications for it. The filler, again, that is used is usually a Juvederm or a Restylane. It's a generic called hyaluronic acid. And what we use to dissolve it in those situations is a hyaluronidase. And I like to use this brand in the office if I reverse somebody, which is rare, or if there's a immediate problem during a fill session where inadvertently or not by anyone's fault, filler is placed in a blood vessel that supplies nourishment to an area, like to the upper lip or to the side of the nose, and that blood vessel is blocked, and it shows immediate signs of distress, redness, whiteness, purpleness, pain. Then you need to dissolve that filler that's blocking that blood vessel. And this is what you need. So you need to have it in the office, nonetheless. So when you're looking at somebody who needs dissolving a filler, let's say it's just because they don't like it, so they come to you in a more controlled manner, you do the usual things. You go through your consultation. You make sure that they are don't have any contraindications or indicators that they shouldn't have this done, and they just have to wait the filler out, meaning the fillers do kind of dissolve on their own. The body naturally produces this dissolving agent, but it works much slower, and it will dissolve that over 6 months, a year and a half, depending on which type of product you used. So you want to make sure that clients that come in can safely have this treatment. People who are on blood thinners, you may have to. make a decision because this can increase bleeding. People who have allergic reactions to some of the components of the dissolving agent, you want to make sure that that's not an issue as well, because you don't want to really treat the area and end up with someone that looks like this, where you have a lot of swelling, you have a lot of redness, and it's just an allergic reaction. And you've got to treat that. Now you've got to treat that with maybe steroids. If it's not too bad, it doesn't cause any breathing problems. If this causing breathing problems, then you got to be more aggressive. You got to treat them with, you know, adrenaline and some other things to make sure that their breathing airway is not compromised. But you don't want to treat somebody for one problem and create another problem. No one ever wants to do that. So you want to minimize and make sure that you understand that patients are safe to have this type of treatment. So consultation and assessment are really, really critical. The results of these procedures is fairly immediate. You know, it takes about 24 to 48 hours to notice some softening, some change in the area that it's injected. There's minimal downtime. Uh, you can, you know, basically have this done. If you want to re-evaluate to see if you want something done again later down the road, you definitely can do that. Again, some of the downsides we talked about a little bit. You can have an allergic reaction, like I've said, to these dissolvers. The dissolving agent doesn't work super evenly, even though you may inject the same amounts in the areas that you need. It may not evenly dissolve it. So you can dissolve filler, let's say, on each cheek, and you expect that the dissolving agent will bring things back equal to a natural state. That's not always the case. So you may have to revisit this again to get back to a natural state. And maybe the natural state is that they had some natural differences from the right side to the left. So you just got to understand that as well. Here's some examples. This is a subtle example of before and after for filler dissolver. On the left hand side, this patient had a lip filler, upper and lower lip. You can see there doesn't look terribly bad. It's a little asymmetric on this on the left picture in the right corner. There's a little less fill to that. There's a little bit of lumpiness as they try to follow the natural grooves and curves of the upper lip. The lower lip doesn't look terribly bad, but I guess the patient just didn't like it at all. And the patient had a filler dissolver placed in the lips. And as you can see on the picture on the right, she's back to her natural state. So you certainly can get a nice result. And at this point, the patient or the client can decide if they want to again try it again at some point, you know, or and then that could be anywhere from about a month from the time you've had it dissolved, or they can decide that this wasn't for them and they're moving on. So I mean, again, you still have options if you decide to dissolve it. Here is another example of a before and after. I think a little more suggestive. You can see it. The picture on the left is the before. She has kind of a flat, I think, kind of like a little sausage lip, and then on the bottom lip, she's a little fuller and a little lumpy, in my opinion. And on the after on the right, she still has a sausage lip, and maybe that's her natural state, but she definitely has more evenness and a smoother lower lip. So again, these procedures and this agent to dissolve works pretty darn well. Again, you can decide to refill if you want to try it again, go to another practitioner. I would advocate you waiting at least a month, and maybe you want to go a lot slower to get to your end. You may want to lose less product. You want to try to avoid overfill filling for sure. And you want somebody who really can assess facial balance very, very well. So again, lip fillers, cheek fillers that are overdone, they can be reversed. So the next particular procedure, we're talking about breast implants. Breast implants are one of the most popular procedures, breast augmentation for sure. I can say probably comfortably for at least 15 to 20 years running. But I think that trend is changing, not to the point where people are never having implants. There was a time when women wanted really, really full breasts, and you saw, some results that were a little ridiculous. I think the time of the big, big boob is gone, and women want something or breasts that are a little bit more natural. There's also some concern now as we know more and more about breast implants and know more and more about the long term effects. There's a little bit of concern about breast implant illness, and we'll touch on a little bit about that. And that may be a reason why women want to have these breast implants removed, or they may even be hesitant to have them placed in the beginning. So, this is a good point of discussion. So, again, I think we're on a different trend. Also, women are having these breast implants when they have complications, just like we talked about the lip. Women who've had older breast implants, maybe even placed in the 80s, which is a long time ago. And these women are senior women, or maybe in placed early 90s, late 2000s. They may have ruptured and capsular contracture, which is a scar underneath the skin of the breast and the breast tissue itself that creates a really hard shell around the implant and at times a misshapen and painful breast. So, certainly, those are reasons that implants may be removed in total. And if they are considered to be replaced by something that's much more modest. Again, they're changing beauty standards, I think are really driving that. Again, culture, influencers, celebrities, the trend of breast implant removal has really doubled from about 2017 to 2022. There's been a big jump from 22 to 23 of almost 9%. And then in 24, there's been reported by the American Society or the Aesthetic Society, excuse me, that 34% increase in breast implant removal. So let me say that again. The Aesthetic Society is reported in 2024, they've seen a 34% increase in breast implant removal. We touched on all the reasons why. Some other reasons maybe women want to be more active. These implants are heavy, so they may cause back pain and neck pain, much like a natural heavy breast. So women may be tired of carrying that heavy implant if they've got a bigger implant in a different era that really champion large breast. Uh, mental health, physical health concerns from breast implant illness, which can be fatigue and joint pain, brain fog, and just overall inflammation. And there's always a chance there's rupture and leakage of the implant, particularly silicone implants. Saline or saltwater implants just leak and absorb. But the modern day version of silicone implants have gotten so good that that's really rare. But older implants that have been in for 20 years, 30 years may rupture and may cause problems. And we'll talk a little bit about that. But I think what's really driving the thought of removal, it's not particularly society and culture and entertainers and celebrities and influencers. It's the always that elephant in the room about breast implants. Are they safe? And I think they're safe. I still provide them as a service. If I didn't think they were safe overall, then I would not. But there is an entity called breast implant illness. It's a debated entity. I'm not saying it's not real. I've actually had a patient who had breast implants placed by someone else, probably 30 years ago. had all these symptoms of fatigue and hair loss and rash and pain and joint pain, and had all this medical evaluation and couldn't find anything. And she came to me because she used to work for me and said, "Doc, I think it's my implants." I'm like, "There's no way. No, I can't do a test before to say it is. I can't do a test to say it was because you're better afterwards. I just don't think it's the problem." And so, long story short, she convinced me to take them out, and I did, and she got better. So this is a thing, if you want to use that term. Again, thousands of women have reported chronic fatigue, brain fog, joint pain, autoimmune type issues. So again, I don't think thousands of women are just making this up. And so our society and other medical societies are really taking a deep dive in this and taking this seriously, and basically doing more research so that we can get more information so that we can identify it better. We can treat women who've had implants more quickly or more rapidly and treat them safely so they can have a better quality of life. The next reason why I think women can have implants out, besides breast implant illness, is that women have older implants and they've had capsular contracture. And let me show you a little diagram about capsular contracture. We're going to start from the left and work our way over to the right. Anytime you place an implant, there's always a capsule. And what I mean by that, there's a scar tissue that kind of envelopes or encircles the implant. And a grade one capsule is a capsule, and we grade them one through four, a scar tissue around the implant that is really super soft. It's like tissue paper. You don't feel it. You don't see the implant because it doesn't kind of outline it. And the patient doesn't have any pain. So, how do we know we have a grade one implant? Let's say that I placed breast implants in a patient when she was 20. She's had no problems. She's had a baby. She's breastfed. She's finished with her family. Her breasts now sit a little lower. They sit a little out to the side, and she wants to have them removed and downsized. She wants her breasts lifted. So I'll go in and do the procedure. When I enter underneath the skin and into the area of the breast pocket, I enter through this little wispy tissue, and I take the implant out and I look on the inside of the pocket, and it's like a pocket. I see this little wispy white rind, for lack of a better term. That's a grade one capsule. She never complained about pain. She never had any hardness of her breast. She never had any outlining of her breast. So it's a grade one capsule. So that's not a problem. Grade two capsule is it's a breast that can capsule that can be uh, felt a bit. It's a little firmer. Well, the implant's a little firmer, but there's no pain. Grade three, there's pain and firmness to the breast. And grade four is pain, firmness in the breast. Implant is clearly outlined. It's like caught. It's like a ball. And so those are the grades of capsular contracture. And you really need to remove not only the implant, again, reason for that coming out, you need to remove that hardened tissue in a grade four or a grade three capsule for sure. Almost peeling it out so that the implant and the capsule itself come out as one piece. And that's called an in block, just as one piece. And you need to try to remove all the capsule because we believe, we're not really sure that this capsule is due to some irritation, either from the surface of the implant, which is really rare because most implants are smooth if they're placed under the muscle, or irritation from just a little bacteria that got on the surface of an implant and caused a reaction. Nothing that would give you an infection where you have redness and drainage, but just enough to irritate it. So we need to remove that bacteria that lives in that capsule so that we have a fresh, clean pocket. So let me show you some examples. All right. So here, and I should have put this graphic up. That it is graphic, and I will put it up for the next one. You can see here on this image, you got capsular contracture, and you have an implant that was taken out in block as one piece with the capsule. The capsule's that little cut edge that's peeled back, and the implant's inside that hard pocket. And that produces down on the bottom a breast that's on our right side, which is actually her left side, that's tighter and higher. That breast is not the good breast. The breast that is lower and softer is the good breast. So she probably presented with pain and discomfort and unevenness. And so we have a capsular contracture. That surgeon removed that implant and that scar tissue totally, and either decided to take both implants out and leave them out based on their discussion with the client, or to replace the implant. And those are the options. So I want to show you a couple of pictures. Excuse me. I'm gonna grab some water. I always get thirsty. I just talk so much. All right. Excuse me. Needed that. Woo! All right. For those of you who are watching and those of you who are listening, you don't have to look away, obviously. Those of you who are watching, I'm gonna put up my little sign that I try to put up. Warning: graphic content coming up. So if you're squeamish and this is not your deal, you don't want to see it. You just need to know about it, but you don't need to see it. Now's the time to turn away, do something else, and just listen. So the first picture I'm going to bring up is a picture. So here you see, and this is actually one of my patients from several years ago who had older implants not placed by me, um, taken out because there was some pain, some malformation or abnormal shape to the breast. And you can see that the implants come out. They're not like solid, round, jelly filled, pockets or patties. They're cracked. You can see jelly kind of oozing out, or gel oozing out. And you see this kind of reddish, angry looking tissue. That's the capsule that was around those breast implants. That capsule is, it can be really thick, and I mean really thick and really hard. It has a lot of calcium in it. It's just a really active or reactive tissue. So that's what it looks like when it comes out. This is what an implant looks like when it's ruptured. And I'm going to play a video here at this stage. And this is my hand on a ruptured implant. This is an older implant.
Perfect.
The older implants, when they
Let's start
ruptured,
that.
this gel would come out and it would just ooze like warm jelly. I'll play that again for the viewers. You can see I'm pulling it up like a spider web. And unlike
Perfect.
the
And
newer
let's
gel
start that.
implants, if a newer gel implant ruptured, then you wouldn't be able to pull it up like a spider web. You will be able to squeeze it. It looks like it's going to come out at you. And then as soon as you let that pressure go from that implant, it sucks itself back in. So it's cohesive. So this is definitely an older implant where you've had a crack in the shell of the implant. This jelly is oozed out. It's irritated the internal tissues of the breast and created this hard scar around it. And that hard scar probably has a little bacteria in it. So you want to remove all of that in one fell swoop. So let's say you do that. What do you do? Do you replace the implant? Do you just do a breast lift? Do you just sew things back up? It really, really depends on what the patient wants. I tend to have clients when they come to me for this who want obviously their breast lifted. And sometimes they want restored volume with an implant, but an implant that's small or is not huge. So what I've done when a woman wants her breast lifted and more volume, but they've got a ruptured implant and a capsular contracture. What I do is I break this down into two procedures, and I know no one wants to hear that, but I think it's the best way to go. Step one is to get the junk out. is to get the ruptured implant out, get the capsule out, clean everything up really, really well, stitch everything back, and let things heal. Let things get back to normal. Does a couple of things. It gives us a better, cleaner starting point if we want to put an implant in. It allows the client to look at her breast in real time without anything being done, no lift, no implant. And she can really size up psychologically if that's okay with her. Am I okay? Do I feel good about this? Do I feel good about myself? And if she feels good about that, then we're done. If she doesn't feel good about that, that really solidifies in her mind that she wants to and needs to do something else. I typically like to wait 3 or 4 months before I go to the next procedure, which may be just a breast lift. If she feels that she just wants to be lifted, doesn't need to be in any fuller, or a breast lift in an implant at the same time, a modest implant. So it breaking it down into a couple of stages really helps the decision making process and gives us the best environment so that we can minimize capsular contracture again. Now, capsular contracture is kind of like keloids. Once you have one, it's kind of hard to get rid of them. Sometimes you can take that method of kind of staging it or doing it step by step. When you do it step by step and you get to that second step, you have a clean, healed environment. You can put in a smaller implant. You make sure that you do all the things to minimize bacterial contamination. You place it underneath the muscle. You do all the things. You may need to even place some additional tissue in the form of what we call an ADM. That's a dermal matrix to help minimize scar tissue around it. But again, despite all those issues, your risk of having a capsular contracture is increased because you've already had one. And so the client really needs to understand that moving forward. We do those procedures, like I said, for clients who want to go through that process and have their implants removed, of course, because there's an issue and then replaced with a lift. I try to wait 3 months between two surgeries that I try to set clients up for the best outcome. And then healing time is about 3 months back to all activity. And then for the final result, I usually say at least a year, 6 to 12 months. Um, Next procedure. Let's talk about BBL. BBL was super, super hot in the day. And I'm gonna say probably starting around, I don't know, 2006. I'm just gonna say that. 2006, the BBL was the thing to have. Jennifer Lopez, of course, what's the girl? Kardashian, Kim Kardashian. Those ladies really like, pushed that procedure forward because women were really into having a full, voluptuous shape. And I think all women were at that point because I think women of certain cultures, and I'm going to maybe stereotype a bit, do not shoot arrows at me, do not put nasty things in my comments. I'm just telling you what I see. Women from Latin heritage, women from African American heritage, they always like a curvy shape because the men or the people who are pursuing them for partnership like that body shape. But, people like J-Lo and people like Kim Kardashian, they push that to another level because women who are outside of those cultures, ethnicities, were looking for the same. And, you look today, there are women who are, really curvy, not crazy curvy. And what I mean by that, they don't have a big old butt and tiny ant legs. And there was a time when you did a BBL, or you saw BBL surgery, and people were really getting the overfilled. They just wanted the biggest butt that they could get. I mean, just huge. They just wanted the biggest butt they could get, and it wasn't proportionate. It was out of proportion to their hips. It was out of proportion to their breasts. It was way out of proportion to their legs. So I mean, they looked crazy. I think as time went on, again, culture shifted, thinking shifted. People were trying to get back to a more natural shape, not straight up and down, but not this huge, and I'll use this vernacular, not the badonkadonk, where you're on a pole and you're at the club. Not that. People didn't, or ladies did not want that anymore. So people were asking, now I've got this big old behind, but I don't really like it. We've moved forward, and I want to see what I can do to make this better, make this smaller, make this more natural. So people are asking, how can I get this done? BBLs are done by placing fat above the muscle. So could they just lose weight? Yeah, they could just lose weight as a reversal. That's possible. Could they have discrete areas of liposuction? Yes, you can have that. That can be done. But you need to make sure if you do that, the skin integrity, the tightness of the skin is really appreciated. Because what you don't want to end up with is with saggy skin. You don't want to end up with saggy skin. So if you do that and you end up with saggy skin, you got to prepare for that. You got to prepare the patient for that. And you may decide at the time that you liposuction this client that you want to take off any excess skin. You want to do some form of maybe a butt lift, where you take out skin above the hips across the back and lift the butt up, or you may decide that, heck, I don't want to do any of that. We're going to liposuction and we got a little loose skin. We're going to let it again sit and kind of contract, see what we have. And there are people that are doing non-surgical butt enhancements. People are doing things like Sculptra, which is an injection of a product that's a biostimulant, which stimulates collagen to fill up volume. So you can definitely have that done as well. So if you decide to have a BBL, you really have to be careful. You don't want to try to liposuction too much and end up with saggy skin, unevenness. You want to make sure that you can address that unevenness, and it may require a large scar on the back. You may not want to do that. You may try to do it the old fashioned way by losing weight. That's possible. You may have it done, deal with the saggy skin. Maybe you want some biostimulant placed in the area that's a little saggy or lacks a little volume for evenness, and you can have Sculptra placed. But this is really unpredictable. I will just say that. It is not as predictable as dissolving lip filler. It's just a different procedure that has a lot of different moving parts. And so you want to consider this really careful. And I think where the rubber meets the road in this procedure, especially now, if you haven't had a BBL, it's not that people aren't doing a BBL. People are concerned that it's dangerous. And I will say this, it has complications, but it's like any other procedure. If you have a surgeon that doesn't know how to do it, is unfamiliar with it, then you're going to have a lot of complications. It is a safe procedure in the right hands, in the hands of a board certified plastic surgeon. But you may decide that you don't want to do it. You don't have to have it done to that level. You can have it done very modestly and give you a nice shape. If you've already had it done and you really knocked it out of the park, now you just gotta kind of realize that it can be improved. It may not be perfect. It may be better, and you may require more than one procedure. So there are trends that are slowly creeping up. One is dissolving a filler for people who have overfilled faces and overfilled lips. Nobody likes that. You can have that dissolved with hyaluronidase or a filler in the office. N- Breast implants, if you're going to get some and you've never had some, people are not going for those big boobs. They're going for more subtle enhancements, more natural, because people are more active. People have concerns about the implants themselves, so they want to make sure they put themselves in the best position. If they have to take them out, that they still will look natural. So they don't go for huge implants that will really change the skin of a breast. People who've had BBLs are really concerned because one, they've fallen out of favor, especially if you got a really large or overproduced result, and you want to really reduce that. They're concerned about how that will look. It's really, really unpredictable. People are concerned who haven't had it but would like some shape to their backside because it's been touted as the most dangerous procedure. It is the most dangerous procedure if you've got a practitioner that does not know what they're doing. Just like a facelift can be the most dangerous procedure if people don't know how to do it and they get into the carotid artery or the facial artery. If you just don't know how to do it, you don't know how to do it. Every procedure is dangerous. So that's why you go to see a board certified plastic surgeon. So I think the goal or the message here is if you hadn't had these procedures, you need to be thoughtful. You can have these procedures. They're not falling completely out of favor, but people are being more that thoughtful. An ounce of prevention is worth a pound of cure. If you've already had these procedures in years gone by, and you've had the over the top breast augmentation, you had the over the top BBL, you've really had your face filled up, you can have these things improved back to a more natural state, but it's not as easy as you think, and it may require more than you think as far as time, money, and effort. So, on that note, I hope you've enjoyed this uh, podcast. I try to hit on some things that give you some points of consideration. If you like my podcast, please like, share, and subscribe to the channel and the podcast. If you want to have a consultation with me, it's really easy. Just call my office at 770-466-4700. We will be happy to schedule a consultation with you. Consultations are $225. If you do move forward with the procedure, that $225 comes off of your surgical quote. So if you move forward, it's like having a free procedure. But we take our time, takes about an hour or a little more, depending on what you need to make sure that you are comfortable with our recommendations and you understand what's possible, what's not possible, so that you can make the best decision moving forward. So that's the most direct way to do it. If you aren't sure, you want to check us out a little bit more, you certainly can go to our website. It's here up on the screen. Just cruise around. We've got all types of information from blogs, videos coming soon. We've got all the procedures that I perform up on our services page. You can read about those. You can even see starting prices. We like to be transparent so you'll know what you're getting into, so you can make the decision that you're ready to move forward before you even pick up the phone. So, on that note, I like to thank everyone for again spending a little time with me today. As always, we will see you next week. And please be safe wherever you are in the world. Until next time, peace.